podcast. I'm your host, Dr. Lilach Saperstein, and on this show, we discuss audiology and how it relates to your life. Whether you're a parent, a student, a professional, you'll find discussions and conversations here about how audiology affects your life and practical, everyday tips for improving the care that you give your patients, the way you can advocate for yourself or your child, and advice for students and young professionals. Today's guest is Dr. Saunja Burt, an audiologist from Florida who has more than 20 years experience, including 17 years as an Audiology Program Manager. Dr. Burt received her BA in Communication Science and Disorders from Hampton University, an MBA from Nova Southeastern University, and her Doctor of Audiology degree from Central Michigan University in 2001, where she became the first Black student to complete a 4-year residential AuD program. Just before we dive into that interview, I'd like to remind you that your comments and your messages are the most exciting part of this show, and for all of us to have a conversation around these topics. So come and join the All About Audiology Facebook group, follow on Instagram and Facebook, and of course, all of your messages are so dear to me, and I answer all my DMs, and I can't wait to hear what you think of our conversation. So welcome Dr. Burt to the show. Welcome to the show.
Well, thank you. I appreciate you inviting me. So just to tell you a little bit about myself, I'm a Midwestern girl. I'm from Ohio, Youngstown, Ohio to be exact. Born and raised. I have 3 sisters. I'm number 2. And people always ask, why did you become an audiologist?
Yeah.
And the reason why is actually my younger sister had ear infection, that she had to have the P tubes. She had speech and language therapy. So much so that one time I went to one of the appointments with my parents and she happened to have a hearing test that day. We go into it's like say the basement because it was the lower level. Okay. And I see this lady and she's explaining everything to my mom, what they're going to do, the hearing test. So while she's talking to my mom, I'm also asking questions like, who is this lady? What does she do? Blah, blah, blah. And my mom was a nurse.
You know how old you were?
I was in middle school, but I remember my mom saying, oh, this is an audiologist and she does this. And the audiologist at the time heard this conversation. She stopped and said, hey, if it's okay with your parents, you can come test your sister's hearing with me. And of course, my parents are all like, yes, go. You know, they're all about that support. I would like to say I did my first hearing test in middle school.
What a great experience. That's so nice.
Yes, it was. And It was really nice, the audiologist. And, you know, at the time, I knew then, I was like, oh, this is great. You know, I ended up attending Hampton University in Hampton, Virginia. They actually had one of the first communication science disorder programs at a historically Black university. And I say that to say, I didn't realize that they had this in undergrad. I went in thinking I was going to be an education major, looked at occupational therapy, physical therapy. And then I went back and was like, oh, let me take this communicative science disorder class. That was my second semester.
We hear from a lot of students, and it's a very common experience that people will say, oh, because of my sister, brother, my parents, or I had a kid in my school who had, you know, some kind of personal connection with learning about audiology as a field, as opposed to just like everybody knows what a dentist is. Everyone needs dentistry. It's almost like, where's the gap with that, like education or even awareness that audiology is a field? That's been a journey of evolution in our field.
Absolutely, because I know since I could remember, I knew I wanted to do something in healthcare, but I thought my mom was a nurse, and I thought, okay, well, maybe I want to be a doctor. So I actually went to medical camp, and I believe it was in high school, and I realized I was like, oh no, this isn't for me. So I knew it was something maybe in the allied health care system, the field that would suit my personality a little bit more.
Sure. I mean, I was all about medicine also in high school. And then we had the fetal pig dissection.
You said that was it?
And I was like, this is enough. I don't think this is a good idea.
Right.
And even though I love being in surgery, when I was working at the hospital, I got to be in the surgeries and doing a lot of the intraoperative monitoring and checking cochlear implants. And I like the drama.
Exactly. Oh no, I'm telling you, I had a great 4th-year externship at the
Yeah.
University of Michigan. And part of that was the interoperative monitoring portion of audiology. And I was like, oh, this is cool. I don't know if I could have been the one operating, but it
Right.
was great
Nope.
to monitor the
Nope. That's
nerve.
way too much responsibility. But I mean, when I'm in the OR, it's like a play, and everyone has their role, and you've got
Yep.
scrub nurse, and you've got all the other people who are like in charge of devices, and one guy who's like, his whole job is to make sure the electricity just always stays stable for all the different drills and lights and things. And yeah, I just like being kind of a fly on the wall, and then stepping in when it's necessary, and then stepping right out.
I like that description. That's absolutely true. Everyone has their role.
And then, you have the surgeon, and then their residents, and sometimes you have students watching. And I love it when the med students like come over and like, what's going on? And then I'm like, well, listen here, med students. I'll explain.
Right. Definitely.
So that's how you came into audiology. And what was your schooling like? What was the experience while you were an undergrad and then graduate school?
Undergrad, like I said, I went to Hampton University, and Dr. Robert Screen was the program chair at that time. He brought the program to Hampton University. One of the reasons is that he felt that this was needed to educate Black students and students from diverse backgrounds. This was needed in our profession. But I had a very supportive instructors there. And the reason why I found out about the AuD actually is because of the audiology instructor at the time, Teresa Graham. I think we had a class of maybe 15 to 20 students, and I probably was the only one who was going into audiology. I knew early on, like, yeah, no, I'm definitely an audiologist. That's what I want to do.
And not a
speech pathologist, which was great. They supported that. But I remember as I was applying to go to graduate school, she was the one who told me, hey, the profession is changing. It's this degree called the AuD, Audiology Doctoral Degree. It's only a few schools that have it right now, but I think you should look into it. And she even, gave me some articles. So I looked into it. And at the time, it was only 3 schools. It was either 2 or 3 schools. I know one school has stopped accepting students because they no longer continue their AuD program. And essentially it came down to Central Michigan was like my only choice, really. Because the other school, I think it was brand new, and I don't know if they were accepting students that year. It might have been the following year.
So for our listeners who are not familiar with this history, basically we had first the master's level, and a lot of audiologists were practicing that way. And then they introduced the doctoral program, and there was kind of like a period of time where it overlapped. I mean, this, you lived through it. I just know historically what a lot of people were kind of grandfathered in, if you use that expression, of they could continue to practice if they had the master's, but any new students needed to complete the doctorate. But then you were in that middle ground.
I was in that middle. And honestly, it was kind of controversial because everyone wasn't on board, to be honest. And we didn't realize that. My classmates and I, we went to our first conference and realized the discussion going back and forth. So anyway, I applied to Central Michigan and was accepted. And I did all this. Back then, no, we didn't have Zoom or these. If we did, we didn't do Skype. So everything was like over the phone interviews. And I was accepted. I didn't visit the college.
Wow.
I didn't do any of that. I had made up my mind already that if I got accepted, I would go. So I'm thinking I was in Michigan. And I'm from Ohio, but I mean, honestly, I'd never been up as far as Mount Pleasant.
So what's the distance, like the drive from Ohio to Michigan?
It was about 8 hours, I believe.
Oh, wow. Okay, so that's not like, I just hop by on the weekend. That's like.
No, right. It was definitely longer than hours. So that was good. When I went to Central Michigan, it was definitely an adjustment going to Central Michigan from Hampton University.
So you were coming from Virginia, from a predominantly Black university.
Right. It was, Central Michigan is kind of I don't want to say in the middle of nowhere, but Hampton, okay. It was full of like a military base, kind of a city. We were close to DC, Norfolk, Virginia Beach. And then I go to Mount Pleasant, and I remember driving up there, we're like passing Lansing and all these major cities, and we are going through like farmland. Um, and my parents looked at me and they was like, are you sure? You sure you want to do this? I was like, yeah, no, I'm doing it. Hey, I'm going to do it. I committed to it. And I can tell you my breakdown was not school. It was Linda C. said Stanford was the clinic director at the time. And I remember I was, this is the first semester there in Central Michigan. And I happened to pass by her office and she said, how are you? And I just was crying. She was like, what is wrong? Like, you just got here. Like, what happened? And it was, I just spent like trying to redo my apartment, was at Target and Walmart. And I just spent all this money and I couldn't find any hair care products. She, you know what? She sat me down, she listened. And I felt better after I talked to her. And I was like, okay, because I'm an out-of-state student. I didn't know, where even to get my hair done. That's like a big thing, for anyone. She called me at home that night and she called the stores and told them that I couldn't possibly be the only student that was having this issue. And she called us, yeah, she did. And she said, Saunja, let me know, what do you need? And they're going to order for you. I was like, okay, I made the right decision here, because it wasn't even a clinical thing, but she took it personal that she called around and took action. So
wow. Yeah, that's pretty impressive.
She did.
But what impresses me from the story is that you were able to be open about what you're going through.
Exactly.
I can imagine other people might feel ashamed or just like, oh, this is, a concern that I'm not feeling comfortable sharing. But you were open. So then you were met wonderfully by a good person who was willing to help.
Yes.
A lot of bravery. And I think students need to hear that.
Yes.
Professors don't only care about the work. They want you to be okay and like for you to get through it.
I had some mentorship at Central Michigan. Linda Stanford introduced me to one of our professors, Dr. Dawn Nelson. She was on maternity leave. And she called her and told her about, my situation and me just adjusting to being at Central Michigan and needed some help. And so Dr. Nelson had me call her immediately. And I did. And that was a great relationship in terms of her being a mentor to me through the program. She also served as the chair on my capstone project and really helped me when I first started practicing audiology. Sometimes you have questions about what you learned in class because she taught electrophysiology, vestibular, and auditory processing. So if I had some questions, she was very helpful to have someone to go back to and get that information. So having a mentor is really beneficial.
Yeah, it's so important to have a mentor and to have those connections with professors. Exactly, like all on a team, and it doesn't end when you graduate. I always kind of, just on a personal note as well, had to learn that difference from in graduate school versus being in undergrad. In undergrad, you're one of 60, 80, 300 in your program, whatever. And then in grad school, you become one of 10 or one of 20, a much smaller ratio. And everybody who is invested in you completing that program.
That's important.
You're all on one team together. It's not you versus professors or administration in a way that it might feel like that in undergrad. And then in graduate school, your partners, they want you to succeed. So go to them with your issues and then try and work things out.
And I have to say, honestly, I was fortunate that I got that in undergrad as well.
Oh, that's
because
wonderful.
the school, we used to joke, but our little department was small, but we were mighty. And I found that in audiology period, I've always been in a smaller group, like audiology, CDL, communication disorders is small, but we close-knit group. Our professors really, really cared. And then to go on to Central Michigan, we were a class of, I believe, 10, a small group, but we had that support. And I feel like even in audiology, we're such a small group, but we are so mighty, and what we do is great. We help so many people. So we are a small but mighty force as well.
I love that. I feel that. I feel that with the All About Audiology community, I feel that as well. You know, I don't have hundreds of thousands of listeners, but I recognize a lot of people who comment. You know, we're the same people. I DM back and forth with students from around the world, and I feel that in the podcast. And I'm glad that you felt that already so early in your in your career.
Yeah.
So what do you think were some of the highlights, top moments from your education, and then some of the challenges or barriers that you overcome?
You know, I love to be around people. I realize now, like, and it gives me energy.
Yeah.
In terms of audiology and graduate school, most of my classmates, we are still really a tight-knit group. Different backgrounds, different, you know, when I say that, I mean, some people grew up in the city, some people grew up, you know, like small little towns, just in general, but we are a small group. I would say that was my highlight. We always tried to have each other's back. Even now, and send them, we might have a little group, hey, this difficult patient, what do you think? You know, or even like, it seemed like we all had children, the ones that do have children are around the same age. So it even spread to like parenting. And that was the highlight, just meeting people. I have that network, that extended network, but also I had some great externships. So I even did one in Vancouver, British Columbia. That by far was probably the best one, just to be in another country and experience, which is great.
What was the setting? Was it a hospital, a private practice?
So it's a private practice. So that I got that private practice experience, and the staff was really great. Yeah, so that was really a highlight. And I even got to travel through the Canadian Rockies. So I just took advantage of being a student and taking in all the experiences, you know.
Yeah.
And that would be like my suggestion to students: take advantage of everything. I even was able to do a mission trip to the Dominican Republic. Let me tell you, I miss those carefree days to take advantage of everything. So students, I'm telling you, if you had those opportunities, take advantage of it.
Yes. Student life.
Right?
Like sometimes I think about, you know, the days that I looked at my afternoon, you know, from 1 to 6 even. And it's like, I have all this time. When's the last time I had 5 hours that were just open, no responsibilities, nothing to go for?
Exactly. When was the last time? I'm thinking, I can't think of it one.
Okay, and not to minimize that grad school is very challenging. You have papers, you have assignments, and clinic days can be very long, but it kind of goes in peaks and valleys. You have like sessions of the semester which are difficult, and then you have like, you know, those clinic days are hard, but it's not always the same kind of.
It's not.
We have a month off in January, like.
Yep. Did we have a? Yeah, we did. I even worked in graduate school.
Oh, what did you do?
I worked in minority student services and was helping out with the mentoring program. So mentoring, and it wasn't just audiology students, but the undergrad students. When they came through, we kind of paired them with someone who was like in their 3rd or 4th year of school, even their 5th year, to help them get through the process. Because, you know, the first year is difficult of college, period. It's undergrad and graduate school. If you can get through the first year, you got it made. So I was able to work in that environment with students. For me, it helped because I was able to enjoy a lot of events on a college campus. So not just audiology, but also do things in the university setting, which was great, and it helped with the transition from, you know, undergrad to grad school, and being okay, and, you know, having another support system.
That's great. So you had a great cohort, and you figured out how to navigate friends and events on campus. You had this excellent internship. Those are good things to put in the bank of good experiences. But I'm also sure there were some challenges.
Yeah, absolutely. Yeah, absolutely. Unfortunately, most of the things you just remember. So I have one, like a patient. I have many, but I remember our first year. Typically, you were paired with another first-year student. And we had a patient who just kept calling me girl, girl. And my classmate, he was like, "Where's the lady? Where's the lady?" And so finally the patient was like, "You know, I don't want that girl touch me again. I don't want to see her." And it's funny because, you know, we had a clinical supervisor who she had just left and went to help two other students, was just across the hall. So I just told my classmate, I was like, "Well, just go ahead. I'll sit back here and, you know, just finish the appointment." And I just remember my supervisor just like apologizing for this guy. Because at the time you just get them, you know, test them, get them done. But I just remember like, oh, here we go. I had to prepare myself to get ready for clinic. We had a test exam that evening. So just trying to clear my mind and get through that. I had many throughout my career. Just, I would say those are most of the experiences, unfortunately, dealt with that. And, you know.
That's very demeaning.
Very.
Yeah. When you're in a position to help this person.
Right. Exactly.
That they would treat you that way. And I think it's very important for us to talk about this for students and professionals and families, you know, all the listeners of the show, to start to say, you know, sometimes we look at the issues of racism as these big conglomerate issues that are just like way too big to look at. And it's like, does it have to do with me, with my profession, with my clinic, with my class, with my family?
Right.
It's like over there. And it's more and more people are starting to really see that it goes deep everywhere. It has roots.
It does.
In every circumstance. And that's why I think it's important to have these conversations and for all of us to learn what those experiences are that we're missing.
Yeah, absolutely. And actually, part of graduating from Central Michigan is we had to do a capstone experience, so research. And I did mine on multicultural recruitment practices just based off some of the experiences I had. And like I said,
I'm sorry, one more time. Multicultural
recruitment practices in audiology. And it was really based off of some of just the need of having more Blacks and other people of color go through the program. So people who don't know the history will think that someone being called a girl is not offensive. But Black people were never men were called boys. Girls, women, grown women, 80 years old, that girl, that's very offensive. Whereas someone else who's younger, they always got given the respect of, she's a lady, she's a woman. So imagine somebody, you know, said that right now, they'll call you a lady and like, oh, that girl over there. So when you talk about my passion is students, I love working with students and I love working with people that's new in audiology that have innovative ideas. I love it. You know, what makes me work as an audiologist, my ideals and my thoughts aren't stale because I'm around these great innovative minds. I truly love it. That's the truth.
That's awesome. So why don't we continue from there? Tell us what you do now. You know, what has been the progression of your career to bring you to where you are now?
I work for one of the hearing aid manufacturers, AuD. I'm a clinic support audiologist for government services. And prior to that, just to understand, I was a supervisory audiologist at the Department of Veterans Affairs, the VA hospital. For 17 years, I worked at the VA. In Florida, yep, the Miami VA, yep, that's where I work. So I definitely feel like my clinical experience in working with veterans and being a supervisor have helped in my current position. I love what I do now because it's putting all that together. I also worked in the school system when I first graduated. I was a newborn hearing screening supervisor. I trained technicians on completing newborn hearing screenings. I did some per diem work at some of the area hospitals. And I would say right now, the position I have now is bringing all that together, all that experience, because it's important. You know, I may receive a call or a question from someone in the field about a difficult to test patient, or they're not sure how to fit this patient. And so I can go back on the experience, a clinical experience. And I love that I get to see, it's one thing we can have amplification in school, that's part of
Like
what we do.
the hearing aid class. Yeah.
Yes, yes, a hearing aid class. But to see the research and the minds that go into developing this technology is amazing. And then just to be able to educate,
Mm-hmm.
audiologists and students on it, honestly, I can't explain it. It's just really a great feeling, because I feel like I'm still helping the end user, which is the patient and the family, but having the opportunity to meet audiologists and clinicians and hearing care professionals from all over the world. So I love what I do. Yeah.
I had a little tiny bit of that experience when I took acoustics, and I was like, physicists and people are studying like psychoacoustics. That's their whole field. Then the next class, we're taking anatomy and studying the people who are using mice models to understand outer hair cell function. And they're like in the lab with mice, microbiology people. And then you're in the next class and you learn about engineers who are putting together these circuits, microcircuits. The more you learn, the more you realize how many people are involved and how many fields of study come together in audiology. And it's that intersection that is like my favorite part of it, where I could have something to talk to an engineer, a biologist, a surgeon, a med student, a teacher of the deaf, a sign language interpreter, like all these different people all kind of have a web within audiology.
Absolutely. Now I'm telling you, that is the part I love. And I work with a great team of people. The chemistry is great, and everyone really comes and they'll put forth their strengths. So I like that. Like everyone, I don't know everything about everything, but it might be, one of my teammates, they do, and they'll jump in and be like, hey, don't worry, pass them to me, I'll talk to them. It's kind of that working together. So I do appreciate that.
And the other thing you mentioned, which is that you had all these different work settings, worked in school, worked with the newborn hearing screening, hospital, worked with manufacturers, customer support, like all those different things. And that's, who knows what will be the next changes.
Who knows? I like, and that's what I like about our profession. Like, don't narrow just to one thing. You'll be surprised. I never thought that I would be on manufacturing side, but I also didn't think I would be a supervisor, but I was, because when I first graduated, I really liked the clinical aspect of working with patients. And I still enjoy that. There's nothing like working with patients and their families. I just feel like I'm still able to do that in those different settings, just in a different way.
So I actually had one of my placements was at the VA in Brooklyn. At the time that I was there a couple of years ago, there were some issues on a national level with wait times and other, VA issues. But the audiology department had like one of the best ratings within the hospital. And I had an excellent experience. The wait time was very short. And the feedback, the patient satisfaction was very high. And I think part of that is because of the excellent access to the latest technology and all the remote things. And I'm very grateful that our veterans can have that service. That's really important.
It is. And that's a great group, the Brooklyn VA. Yeah, that's a great group.
I'm so honored to work with them. Fabulous people.
Yes. I think that's another great thing of what I do now is I literally get to meet audiologists all over at the different VAs and active duty. So the one thing that's positive about COVID-19 is everybody's moved to remote. So typically I wouldn't travel to all the different sites on a typical day, but because of this, we're able to meet people through Zoom calls, through just video conference calls. So I've been able to face-to-face see people that probably typically wouldn't. I might see them at like a national seminar or something like that. And it's been great. It's been fun, actually.
COVID has separated and connected. It's done a lot of weird things. That's very cool. Well, my last question, what advice can you offer to the individuals and their families that are having, someone in the family has a hearing loss, and that's the old saying, if one person has a hearing loss, everyone has a hearing problem.
Mm-hmm.
Because
I would say always, if you're a parent, if you're a daughter, son, you don't feel bad about being an advocate for your loved one. Just from personal experience with my mom, we had to be an advocate. That maybe they can't speak up for themselves, or their day to day. Don't back down. If you feel like you be an advocate. My second thing is do your research. I used to love, some people didn't like this, when patients would come with all these articles and all this information. To me, I looked at it as a chance for us to discuss the information, and to educate each other. And then you find a way of finding out what is the patient's expectations. But as a caregiver, family member, don't be afraid to do your research. And hopefully you have a provider that is willing to sit there and talk to you and then go over that information with you. And if you're not, my third thing is get a second opinion. It's okay. Go get another opinion and find someone that you feel comfortable with, that's patient, and will help you walk through the process. That's always my three, is research, and if you need another opinion, that's okay too.
Now, if anyone has been listening to the show, I did not feed you those answers.
No, you did not.
That's everything I ever talk about. So I just had,
really?
I talk all the time about advocacy. In fact, I have the FIG method framework that I give workshops on advocacy. That's like one of the biggest things with parents. And the second opinion thing, we have definitely mentioned that numerous times. And
you know what? I put myself in the shoes, honestly, is the steps that I had to walk through myself. So yes, I'm an audiologist, but I'm also a parent, and I'm also a daughter or granddaughter. And so these are things I have to live with myself. So I had to do those things. And I would say if you do not feel comfortable, if you feel like it's okay to get a second opinion, sometimes you might need to get a third opinion to get, so, and that's okay.
Yeah.
Because at the end of the day, you're trying to help this person live a comfortable life, one that they could thrive in that environment. You look at the end goal, and your end goal is to make sure your child or your family member is okay in the long run. So you did not feed me that information, I promise.
I'm just like listening to you like, wait a minute, you're taking all my lines. It's a good thing. I mean, I feel like many audiologists and audiology as a profession, we automatically need to come from a place that's more patient-centered to begin with, because it is about communication, and it is about how are you navigating the challenges of your life, how's work, and what's the educational barriers for students in the classroom. We're constantly looking at the effects of, and not just like strictly the medical part of it.
Mm-hmm.
Or at least that's how I experience my education.
Yeah, and you have to realize there's a person on the other end of what you're doing. When I have students, that's the main thing I tell them. A lot of students come with the book knowledge, but I've always thought, as a supervisor, my job was to help them develop that bedside manner on how to bring it all together. Because sometimes it's one thing to see something in a book, but let's be honest, that doesn't always happen on the clinical side. And I found students concentrating so much on trying to get these exact marks. And I'm like, hey, but it's a person on the other side. Let's find out about this patient. Let's find out how we influence their life. It's so much more to what we do.
Mm-hmm. I was recently speaking with a student who was telling me about vestibular testing, balance testing. And she was telling me that it's so difficult to, get all the different steps right. It's quite a complicated test, the calorics, and that she doesn't want to take up time because here this person she's making them dizzy. And she wants them to be done with the test, but at the same time, she's still learning how to do it, in a way that's correct, but also efficient. And I feel like that's one of the most difficult areas of audiology that I personally don't have that much clinical experience with. Oh man, just to be thinking about people who come in and say that they're dizzy or, that they experience imbalance, that affects your whole quality of life. People afraid to stand up from a chair also then become isolated and all the things that come with that.
And that's the takeaway, that what we do is so important in every aspect of how we're influencing someone's life, from balance to the hearing loss, even with auditory processing, traumatic brain injury, like it's so many things that we as audiologists should be proud of what we do it well, but like always remember that it's someone on the other end that we're helping. Like, how would you want to feel if this was you? And that's what you treat people the way that you want to be treated. That could be your child, your parent, your grandparent, and you would advocate and you would want them to live a quality life. So always remember that.
That's excellent advice. Thank you so much. Thank you, Dr. Burt, for coming on the show and for sharing your experiences with us.
I appreciate you inviting me.
If anybody was interested in contacting you or learning more about your work,
yeah, they can always email me at Dr. Saunja Burt at gmail.com. And it's one word, Dr. Saunja Burt at gmail.com.
We'll have that linked in the show notes as well, along with a full transcript of today's conversation.
Absolutely. Okay. And I also can be reached on LinkedIn as well.
That's how I found you. So that was awesome.
Thank you again to Dr. Burt for coming on the show and sharing her story with us and so much great advice and wisdom. As always, you can find full transcripts of every episode at allaboutaudiology.com. And I do love getting to know you, the listeners, over on Instagram and in the Facebook group, All About Audiology Podcast Facebook group. It's really, really so wonderful and so meaningful to get to know you, whether you're a parent to a child with hearing loss or a student of audiology or a related professional. I really appreciate this community and all of us coming together to make the journey a little bit more human. There's people on every side of it. And again, I want to remind you that if you can become a patron of the show, it would absolutely help me produce more beautiful, heart-centered conversations to share with you. And you can become a patron at patreon.com/allaboutaudiology. And a quick reminder to the students out there that international office hours with Q&A take place on the first Wednesday of every month. And if you have any questions or anything you'd like to share with me, DM me on Instagram or Facebook, and I can't wait to hear your takeaways from today's podcast episode. I'm Dr. Lilach Saperstein, and this is the All About Audiology podcast.